Hello, I'm Dr. Kim Paris, and I am the proud director of Poly Humboldt's RN-BSN program, and here to give you some information about the program. It will take about 15 to 20 minutes and hopefully answer all or most of your questions. If it doesn't, please reach out to me. You will see my contact information a couple of times in this presentation, and it's also on the website. And I really enjoy meeting with nurses, nursing students, people who are interested in pursuing a higher degree. I was recently on this journey myself, so I do recognize how challenging it can be, and it takes a lot of research to find the right program for you. And I want this program to be the right fit if it's the right choice for you. So hopefully we will answer your questions and inspire you to continue on this journey. So in this presentation, you'll get an overview of our program. I'll talk about the admission requirements, talk about the application process, get you some more contact information, and even a link if you want to schedule an appointment with me. I highly encourage you to do that, just to check in and let me, answer any questions that you might have if you're on the fence about pursuing this program or another program. I'll provide you with a program overview. This is our team. It's myself and Dr. Eden Donahue and Kevin Calando. We all work really closely together here in the same building. I have been a registered nurse in our community here in Humboldt for about 30 years, and I have worked in a variety of settings. Most of my career, I worked in an outpatient setting, and in that setting, I really started to dream about a new role for nurses, and I needed to get more education to move my ideas forward. I knew that was a step that I needed to take. I had an associate's degree, and in my 40s, I made the leap to start seeking a program that would fit in my life. I found that, and I thought I was just going to get some initials behind my name to add some credibility and help me move up the leadership chain. But it did so much more than that for me. That experience truly reinvigorated my outlook on the whole profession of nursing and my role in that profession. So I hope to do that. That's the reason I'm in this position, is because I want to inspire the future of nursing and nursing students to be the best that they can be, to be as fulfilled as they can be, and to feel like they have a place in changing the landscape of healthcare for the future. Dr. Eden Donahue comes to us from Sacramento State. She worked there for many years in teaching the master's program and the DNP program. She is a school nurse, and she just brings a wealth of experience in academia, in community health, in rural nursing, and I'm so grateful to be working alongside of her. And Kevin Calando is our administrative analyst. He works closely with us as well, handling all of the administrative things that we do in nursing and supporting us. And he will be your go-to person for general questions. And once you're enrolled in the program, if you decide to do that, he will be handling, again, all of those administrative types of duties that are required for the program. And Taylor Bloden, Dr. Taylor Bloden, comes to us from the School of Applied Health, where our program is housed. And she teaches in the third semester of our program. She teaches the community-based nutrition course. And so she's someone that once you're enrolled, you'll be seeing her face in the third semester. And we have a variety of lecturers that rotate through the program, so you can check our nursing website to see who's working with us for updates on that. The mission of our program is to prepare nurse leaders to utilize who understand health disparities, rurality, cultural humility, and advocate for the physical and psychosocial health of the region's communities. That's our program's mission. And this slide that you're looking at really demonstrates kind of a big part of the core of what we're teaching in our program, that we're teaching to a whole person healthcare and access to healthcare is really a very small part of that. So we're looking at all of the components that make up a person's health, including their socioeconomic factors of where they work, live, and play, their physical environment, their health behaviors, etc. And that this model and framework is weaved throughout the entire program. Our vision is to revolutionize rural healthcare through nursing education and to optimize new roles for nurses based on community engagement, leadership, and social justice. I'm a big believer in partnerships. We have very strong partnerships in our local community and have built relationships with agencies across the state as we have nurses coming to us from all over the state. And in this program, you will learn to develop those relationships as well. You'll be learning about your community in depth and about the gaps in healthcare and thinking about how nurses can fill those gaps. Why do you want to get a BSN? Some people may ask you that. You can go to work straight out of your community college with an associate degree in nursing. That degree is going to prepare you for entry to practice. And it's a wonderful role working in a hospital setting or another setting where you can work with an associate degree. Many hospitals are now requiring a bachelor's, so there's one reason that you may want to advance your degree just for those initials, and because the research shows that hospitals have improved outcomes when they have a greater percentage of bachelor's prepared nurses. But beyond that, when you're going through bachelor's, master's, doctorate programs, you're really advancing your critical thinking. You're learning to think in a systems perspective, thinking about the whole picture beyond that patient that's right in front of you. You're going to learn to do research. You're going to channel your passion through this program and through your research, the things that you're passionate about in nursing and healthcare, the things that you want to see change. You will develop leadership skills from day one in this program and from the very first assignment. You'll be beginning to develop analyze and develop those skills, your own leadership style and looking at the leadership styles of others. We are very heavy on community health and thinking about the role of the community in healthcare. You'll be eligible for public health certification when you graduate. So that is required if you're ever interested in working for public health. And then you'll have a community health field course. In that course, you will be assigned to a community agency where you'll take a deep dive into a particular agency and serve about 130 hours. And then in the final semester, you're going to develop a leadership capstone project. So you really are going to take your nursing to the next level through your Bachelor's of Science program, and in particular through this program. And why this program? Again, we are very community focused. We're talking about the community and the relationship of nurses from the very first semester. You will have that field placement and a capstone project. Is designed for working nurses. So this is an asynchronous program, mostly online, except for 2 weekend intensives. One is in person and one is online. So nurses who are working can do this program at their own pace. We're going to learn practical strategies to think about innovative solutions to promote a culture of health and wellness in a rural region and others. So teaching nurses to think outside the box. And again, you will be eligible for a public health nursing certification when you graduate from the program. You'll gain leadership skills to lead in a variety of settings in the hospitals and beyond. And so there's a number of reasons why this program. Other reasons, we're a very small program, we're a cohort model, which means that you will go through this program with a group of people that will become your buddies and likely your buddies for life. It's an intimate program, about 25 students per cohort with very close connections with your faculty. So those are some of the things that our students have appreciated about the program. And emerging roles and opportunities for BSN nurses. This is something I feel very passionate about, particularly in outpatient settings where we're still developing that role for nurses, even in this era of nursing, and thinking about how we can fully optimize the role of the nurse in outpatient settings. But these are a list of some of the types of things that you might think about beyond bedside nursing. Some of the places you might work, again, thinking about beyond the hospital walls. Oftentimes nurses aren't exposed to these areas of healthcare when they're in their 2-year degree program. So these are opportunities that you might consider as you're moving along in your nursing trajectory that you might not have considered before. And that's another reason why I feel very passionate about exposing nurses to thinking about opportunities, again, beyond the hospital walls, where they can make an impact before people get to the hospital. And these are our application requirements. We require these 8 core prerequisites to be completed, ideally, before you enter into the program: written communication, oral communication, critical thinking, statistics, anatomy and physiology, chemistry and microbiology. Many nurses have met these requirements when they've gone through an associate degree program, but some have not. So you'll want to review your transcripts, see if you have or have not met those. If you're ready to apply, you'll want to go through this checklist and make sure that you have these classes completed before you apply, and meet with me if you have questions about that. And we require an associate degree in nursing and to pass the NCLEX exam, and an overall GPA of 2.75. This is a course roadmap, and you can download these slides and take a closer look at this if you would like to do that. This is also listed on our website, but this is the roadmap of courses in the order that you will take them with your cohort. And so you can see in semester 1, you take development for professional practice and nursing informatics. And those are the 2 courses that kind of launch you into the program and set the stage and the tone for the whole program. And then in semester 2, you'll take health assessment and promotion across the lifespan, pathophysiology for nursing practice. And you have a couple of upper division courses that you'll be required to take unless you have already taken those. In the 3rd semester, you take 3 classes. You'll take community and public health nursing and the field-based course, and you'll also take a community-based nutrition course. And then in the 4th semester, you'll take leadership and research courses. So in that 3rd semester is when you'll want to plan to be able to take about a day a week to work in a clinical agency. And you'll be serving, again, about 130 hours, which works out to be about a day per week serving in a community-based placement. One of the kind of hallmarks of our program that we're really proud of and that our students really have enjoyed are our 2-day weekend intensives that students attend twice a semester, all day Friday, all day Saturday, and at the middle and the end of the semester. So we have one in October that is live on campus, and one in December that is virtual, then another virtual intensive in March, and then at the end of the year, students come to campus again. So it's an opportunity to be face-to-face with your peers and just have that community building experience. We invite guest speakers to come in, and students get an opportunity to do their presentations together and hear their peers' presentations, opportunity for interactive problem solving and dreaming and envisioning about the future of nursing. So this is where the magic happens. This is something that is very special and unique to our program, and it's something that we're really proud of, continuing to do this piece of the program where we get to meet face-to-face with our students as well and feel that energy together with you. This is our 2 cohorts who came together and during one of our intensives. Of course, this was during COVID, so everybody was masked at the time. just give you a little introduction to some of our students and the energy that you can see that they have when they come together. Another thing that we're really proud of and that you'll experience this program is virtual reality with embodied labs. And this is an innovative way that we're teaching where students have an opportunity to see healthcare through the lens of the patient. So they're literally becoming the patient through this virtual reality experience and interacting with the healthcare world, with family members, with community members. And it's really a way that we have discovered to help build that empathy and walking in someone else's shoes. And this is something that has been very profoundly impactful for our students and something that we're really proud of. And cohort 2, this is our second cohort, giving their health literacy presentations. This is during the very first semester. And you can see they're doing their presentations live together in person. Caring Science and Mindful Practice. Our program is framed in Caring Science, Mindful Practice. It's a way that we believe will help address the burnout in healthcare. We believe it's critical that nurses are understanding and learning how to take care of themselves so that they can be resilient and so they can take care of others. And so this is something that we're continuing to weave throughout our program. And it's a journey that we're all on together as we're all, navigating this world that we're in and, trying to reserve our resources so that we can continue to be mindful and present for the people that we're working with and taking care of. We talk about the application process. So applications for the program typically start in October, on October 1st. That's when the university's cycle opens up. And we have 25 students per cohort that we admit. It takes about 21 months to complete the program. We have a fall start only. So students start in the fall and they graduate in May of their second year. The cost is around $15,000, including tuition and books and supplies. And then I'll show you a cost breakdown on the next slide. And again, you can download these slides if you want to take a closer look at those. And they'll be posted on our website as well. It's a hybrid program. So again, we are hybrid. Most of the program is online, designed for working nurses to do the modules and the learning at their own pace. And then we come together for those live intensives for the magic to happen. This is a cost breakdown. And you can see that the tuition is about $1,600 per semester. They do allow you to make payments. And some other breakdown of the fees. So it's around $14,700, including books and all of those things for the entire program. There's a lot of opportunities for scholarships. And I'll move on to the next slide to talk about that. So financing your education, you definitely want to complete your FAFSA, even if you think you might not be eligible for grants and things. That's the way that you're going to get yourself, figure out what opportunities you might have available to you. There are lots of opportunities for scholarships through the university, many nursing scholarships, and also look into your professional organizations. The nursing honor societies often provide scholarships, and Google is another way to search for nursing scholarships. So it's often not as intensive as you think it might be to apply for these. And we find that many times students aren't applying for them. So those are missed opportunities. So I encourage you to seek those opportunities for funding your education, and also ask your employer right up front if they have opportunities for tuition reimbursement. Many do. And if they don't offer reimbursement, where people are really struggling to keep nurses these days. So what kinds of incentives are they offering for nurses to pursue a higher education. Maybe it's an increase in pay when you graduate. Maybe they have some kind of educational stipends or things like that. So just ask the question. So again, just advocate for yourself, ask about tuition reimbursement. Employers need you, and they need BSN prepared nurses, whether they know it or not. They need you to be that frontline leader to, help have that systems lens on healthcare and be a partner in developing the future of nursing and creating the future of nursing. Talk about your plans for education and be realistic about your time off for school, but don't underestimate yourself either. Oftentimes we have a lot more time in our schedules than we give ourselves credit for. And so just, again, be realistic about the time in your life that you need to take for pursuing your education. This is instructions for how to apply. So you go to Cal State Apply and create an account. And in your extended profile, make sure that you indicate that you're pursuing a bachelor's degree and that you have 60 units or more, 90 quarter units. You're going to select nursing at Cal Poly Humboldt, and then you're going to fill in all the required fields for the application and then submit. And then there's a helpline here if you have any trouble with it. And I am also here. If you have trouble with that, you can reach out to me and I'll connect you to the person that can help you, move through that process. And that concludes the presentation, but I do have my contact information here. And if you email me, I'm happy to set up a time to meet with you personally. You can schedule a Zoom consultation with me and I can answer all of your questions. I'm happy to do it. So thank you so much for your time and for listening. And I look forward to seeing your interest forms come through. When they come through, I will reach out to you. And I hope to see your application come through to the program. All right. Thank you very much.